Hi everyone. This session is a completion for the previous session where I covered the blood with special focus on red blood cells and plasma. In this session I'm going to talk in more details about the different types of white blood cells as well as the platelets, also we call them the thrombocytes. The objectives of this session are to describe the structure and function of different types of white blood cells or leukocytes, to define the terms leukocytosis and leukopenia. And these terms are related to the count of white blood cells in the blood. Then I will discuss the importance of the total leukocyte count as well as the differential leukocyte count. Then I will describe the structure, function, and origin of platelets or thrombocytes. So white blood cells or leukocytes, leuko means white, so these are the white cells in the blood. They are not red because they don't have the heme ring of hemoglobin. So the white blood cells have nuclei, so they are real cells. They are unlike the red blood cells that lack nuclei, but they do not contain hemoglobin. So they are nucleated cells, but they lack hemoglobin. That's why they are white in color or transparent. The total leukocyte count, or TLC, is about 4,000 to 10,000 white blood cells per microliter of blood. Some textbook can go up to 11,000 white blood cells per microliter of blood. The term leukocytosis means an increase in the number of white blood cells above 1,000 white blood cells or 11,000 white blood cells per microliter of blood. Leukopenia is the opposite. It is a decrease in the number of white blood cells below 4,000 cells per microliter of blood. What are the different types of leukocytes? We have, or we can generally classify leukocytes based on the presence or absence of granules, open staining of the white blood cells with a special stain and examination of these cells under the light microscope. So white blood cells are classified as either granular or agranular, depending on whether they contain, when stained with specific stains or dyes, cytoplasmic granules that are visible under the light microscope. And be careful, it is under the light microscope, because under electron microscope all different types of white blood cells have granules. But under the light microscope with a special stain, some leukocytes show granules, others do not show granules. So we have the granular leukocytes, also called granulocytes, and we have the agranular leukocytes, also called agranulocytes, cells that lack granules. What are the granular leukocytes? Three of them you should know. Number one, the neutrophils. These are the most common and most abundant type of white blood cells, as well as granulocytes. You can see them here in this picture. Then we have eosinophils and we have basophils. As you can see, we can see here in the cytoplasm granules of different colors that fill the cytoplasm. Open visualization under the light microscope. That's why we call them the granular leukocytes. The agranular leukocytes are of two types. We have number one, the lymphocytes of different types. You can see that the thin rim here of the cytoplasm lack any granule. So we can't see any granules using the light microscope. Also, we have the monocytes. Again, we don't see the coarse granules that are seen under the light microscope when compared to the other three granulocytes. What is a differential leukocyte count? A differential leukocyte count is if we count 100 leukocytes in a blood film, what is the percentage or proportion of each type of leukocyte? As you can see here, we have the neutrophils. These are the most abundant. 60 to 70% of all leukocytes present in the blood are neutrophils. Then lymphocytes are second in terms of amount or percentage. So we have 20 to 25%, sometimes up to 30% of the white blood cells that are present in the blood are lymphocytes. Then we have the monocytes, 3 to 8%, then eosinophils, 2 to 4%, and then the least abundant are the basophils. They account for 0.5 to 1% of the total leukocytes. To remember or to make memorization easy, there is this mnemonic that lets you remember the abundance of the white blood cells. Never let monkeys eat banana, where the N stands for neutrophil, L for lymphocytes, then monocytes, then the E in eat for eosinophils, and finally B for the basophils. Let's start with each type of leukocyte, its characteristic features, and its main functions. The most abundant, as I said, are the neutrophils. They represent 60 to 70% of the total leukocyte count. The nucleus here, as you see in this image, has multiple lobes. Please be careful. These are not multiple nuclei. So the leukocyte or this neutrophil has one nucleus, but the nucleus has many lobes. So the nucleus has 2 to 5 lobes. The young cells have less lobes, and as the cell goes with time, the number of the lobes increases. So if we see 5 lobes, this means that this neutrophil is an aged neutrophil. As the cells age, the number of nuclear lobes will increase. And since they have multiple lobes, or the nucleus has multiple lobes, also neutrophils have another name. This is polymorphonuclear leukocytes. Polymorphonuclear, it means the nucleus has many shapes or many lobes. The cytoplasm, as you can see here in this image, contains both eosinophilic and basophilic granules, the pink and the dark purple granules. So we have acidophilic and basophilic granules. That's why we call them neutrophils, since the cytoplasm contains both types of granules. The main function of neutrophils that you should always remember is phagocytosis. Neutrophils are phagocytes. They can engulf dead cells, microbes, and other worn-out materials or products of damaged cells. The lifespan of the neutrophil is few hours, so it ranges from few hours, 4 to 8 hours in the blood, and 4 to 5 days in the tissue. So they have longer lifespan in the tissue compared to the blood. They are considered as fast responders to bacterial infection. These are the first cells that arrive to the site of bacterial infection. So they are the first defenders, and they are phagocytes. So they are the first line defense against any bacterial infection. And this should always be remembered when we talk about neutrophils. Neutrophilia is a term that is used to describe an increase in the number of neutrophils, and this happens, of course, in bacterial infection, in different types of stress, and also during inflammation. Now let's go to the second type of granulocytes. These are the eosinophils. Their old name is acidophils because the cytoplasm is packed with acidophilic granules. They represent 2 to 4% of the total leukocyte count. The nucleus here, again, we have a single nucleus, but it has 2 lobes. So it has bilobed nucleus. You can see this is the nucleus, and it has 1 lobe, and here another lobe, and they are connected together. The cytoplasm, as you can see, also contains coarse acidophilic granules, pink in color. These granules contain various enzymes, mainly histaminase. This is an enzyme that breaks down histamine. Histamine is one of the main inflammatory mediators, especially during allergic reactions. So if the eosinophils contain or release histaminase, this will break histamine and decrease the effect of histamine during allergic reactions. What are the functions of eosinophils? Eosinophils are able to engulf or phagocytize antigen-antibody complexes. So this also helps in reducing the allergic reaction. And also they are able to destroy parasites. They release enzymes on the surface of the parasites. This will cause the damage or the digestion of the parasites. The term eosinophilia means an increase in the number of eosinophils, more than 4% of the total leukocyte count. And of course, it happens during allergic reactions and also with parasitic infestation or when we have internal parasites. Basophils are the least common white blood cells and also the least common among all granulocytes. As you can see here, we have coarse, dark purple granules that even can mask the nucleus. We cannot see the nucleus clearly. They represent 0.5 to 1% of the total leukocyte count. The nucleus is again bilobed, but it is not easy to see the nucleus here. The cytoplasm contains large, deep purple-colored granules which often cover the nucleus, as I explained a few seconds ago. The granules contain inflammatory mediators like heparin, serotonin, and histamine. All of these intensify inflammation and are involved in hypersensitivity or allergic reactions. So the basophils mediate inflammation and allergy. Basophilia is the term that we use to describe an increase in the number of basophils, and this happens in allergic reactions and also in blood tumor, which is leukemia, or the different types of leukemias. Now let's go to the agranulocytes. Lymphocytes are the second in terms of number or percentage after the neutrophils. They represent 20 to 25% of the total leukocyte count. As you can see, the nucleus is large, indented from one side, and there is a very thin rim of cytoplasm that lacks granules, that lacks coarse granules. So we cannot see any granules under the light microscope. The nucleus is round, slightly indented. The cytoplasm forms a thin rim around the nucleus, as you can see here. And their main function is to play a role in fighting viral infections. Most lymphocytes continually move among the lymphoid tissue, lymph, and blood. So these are the only white blood cells that can leave the blood and come back to the blood, as I will explain later on. The lifespan of lymphocytes is about 100 to 300 days. Just I want to attract your attention here to the red blood cells. Here it has, or the red blood cells have pale central region because they are biconcave, and this is the thinnest part of the red blood cell. What are the different types of lymphocytes? We have at least, or you should know at least 3 different types of lymphocytes. We have the B lymphocytes. These lymphocytes open stimulation, they will mature into plasma cells, and the plasma cells will release different antibodies that will circulate in the blood, and they contribute to the humoral immunity or antibody-mediated immunity. Then we have the T lymphocytes. They do not produce antibodies, instead they kill the target cells like cancer cells and virus-infected cells directly. And they contribute, or they form the cell-mediated immune response of the acquired immunity. And of course, we know very well that T lymphocytes are of different types. We have the helper T cells, we have the cytotoxic T cells, and we have the regulatory T cells. And the last type of the lymphocytes are the natural killer cells. They attack wide variety of infectious microbes and certain spontaneously arising tumor cells, and they are part of the innate immune response because they are non-specific when compared with the cytotoxic T cells. The last leukocyte or the last type of leukocytes are the monocytes. These are agranulocytes. They have a kidney-shaped nucleus. So all the white blood cells contain only one single nucleus, and cytoplasm with or without granules, whether they are granulocytes or agranulocytes. And you can see here the cytoplasm lacks coarse granules. That's why they are agranulocytes. They represent 3 to 8% of the total leukocyte count. They have single-shaped nucleus, as you can see here, this part of the slide, and they leave the bone marrow before they mature and circulate in the blood for about 20 to 30 hours. Then they enter the tissue and they mature into the macrophages, the most important and most powerful phagocytes in the body. And these macrophages live for months to years. Some of the macrophages become fixed macrophages, like the ones that we find in the liver. We call them Kupffer cells. Those in the spleen also as well. And others are wandering macrophages. They don't stay in one tissue. So they move around and gather at the site of infection or inflammation. So they are attracted to the site of infection and inflammation. The main function of the phagocytes is phagocytosis. Please remember, monocytes are not phagocytes. They cannot undergo phagocytosis. They should mature to macrophages, and then the macrophages will be able to undergo phagocytosis. As I said, the white blood cells are produced in the red bone marrow. Like red blood cells, like the platelets, they will circulate in the blood for a while, and then they will leave the blood to enter the different tissues. The process of leaving the blood to enter the different tissues is called emigration of white blood cells. So many white blood cells leave the bloodstream to collect at the site of pathogen invasion or inflammation. Except for lymphocytes, only lymphocytes can move in and out. Other white blood cells, once they leave the bloodstream, they never go back to the blood. Emigration or diapetesis is the process of leaving the bloodstream, as you can see here. White blood cell will undergo a certain process or will go through a process, then it will leave the blood by squeezing itself through the slit between adjacent endothelial cells, the epithelium lining the capillaries. The cells first roll along the endothelium. They start rolling along the endothelium, then they stick to the endothelium, then they squeeze between the endothelial cells through the slit or the cleft between the endothelial cells. We need precise signals for this process, and the signals vary for different types of white blood cells. For example, adhesion molecules that help white blood cells to stick to the endothelium. For example, for neutrophils, we have selectins that are present on endothelial cells and stick to the surface of the neutrophils. So we have these small selectin molecules that are present on the endothelial cells. And then we have integrins that are proteins present on the surface of the neutrophils and attach the neutrophil to the endothelium, and this will assist in their movement through the blood vessel wall between the clefts or through the cleft between the adjacent endothelial cells. So now let's talk or put all functions of white blood cells together in their function or their main function in the defense against different pathogens or different invaders or damaging factors. Phagocytosis is done mainly by neutrophils, which are the first line of defense, and of course macrophages that are the second line of defense. Neutrophils respond more quickly to the tissue destruction by bacteria. Monocytes, because they are the immature form of macrophages, they need time to reach the tissue, and also they need time to mature into macrophages. That's why macrophages are the second line of defense against bacteria infection. So monocytes take longer time to reach the site of infection, but can kill more microbes after differentiating into macrophages. So in terms of phagocytosis, macrophages are more powerful than neutrophils. But in terms of response, neutrophils are faster. They reach the tissue early compared to the macrophages. Neutrophils and macrophages are attracted to the site of infection or inflammation by several different chemicals, and this is a process called chemotaxis. These chemicals include toxins produced by the microbes and also molecules that are released from the damaged tissue, so damaged tissue products. After engulfing the pathogen by the phagocytes, either neutrophils or macrophages, several chemicals are activated to destroy the pathogen. And this is mainly the function of lysozymes, the organelles that are present inside these phagocytes. At the site of inflammation, basophils leave the capillary and release granules that contain histamine, heparin, and serotonin. These intensify the allergic reaction or the inflammatory reaction. Eosinophils are able to phagocytize or engulf antigen-antibody complex and are effective against parasitic infections, as I mentioned earlier. Lymphocytes are the major soldiers for immune system battle. B lymphocytes mainly destroy bacteria. They can differentiate into plasma cells, produce antibodies, and these antibodies will help in the destruction of bacteria. T cells destroy viruses, fungi, transplanted cells, and cancer cells or tumor cells. They are responsible also for the rejection of transplanted organs as well as the blood transfusion reactions due to incompatible or mismatching transfusion of incompatible blood or mismatched blood. The last type of blood cells are the platelets or thrombocytes, the cells that contribute to the formation of thrombus. And these are the smallest blood cells, and they lack nucleus. They are non-nucleated, similar to the red blood cells. So under the influence of the hormone thrombopoietin, the myeloid stem cells that are present in the red bone marrow will develop eventually into a huge giant cell inside the red bone marrow called megakaryocytes. Each megakaryocyte will splinter or will divide to give about 2,000 to 3,000 fragments, and each of these fragments is platelet. So each fragment is a platelet and is enclosed in a piece of plasma membrane, and it has a diameter of 2 to 4 micrometer in diameter. So it is the smallest blood cell. They break off from the megakaryocytes and the red bone marrow, and then they leave the bone marrow and enter into the circulation as platelets. They are disc-shaped with many vesicles, but they have no nucleus. As I said, they are similar to the red blood cells because they lack the nucleus. The granules that are present inside the platelets contain blood clot promoting chemicals, chemicals that promote or initiate the clot formation. Their main function is to help stop blood loss by forming platelet plug. So they play a very important role in hemostasis. Platelets have short lifespan, about 5 to 9 days, and the 8 platelets are removed by the macrophages that are present in the spleen and the liver in a similar way to the removal of the 8 red blood cells. The normal platelet count is between 150 to 400,000 platelets per microliter of blood. The term thrombocytosis means too many platelets, and this is usually due to inflammation, infection, or cancer. This means that we have a platelet count more than 400,000 platelets per microliter. The opposite is thrombocytopenia, which means too few platelets. So platelet count less than 150,000 per microliter. It is caused by suppression or destruction of bone marrow, like in malignancy or after receiving radiotherapy. The low platelet count leads to spontaneous bleeding because these are the cells that are important for thrombus formation. So a decrease in their number can lead to spontaneous bleeding. And this is especially true if we have a platelet count less than 50,000 per microliter, and this count is diagnostic for thrombocytopenia or severe thrombocytopenia. And usually thrombocytopenia is treated by giving a transfusion of concentrated platelets. So once blood is donated by a donor, platelets are separated or isolated from the whole unit of blood. They are concentrated and then given to the thrombocytopenia patient. Here you can see a summary of the different formed elements of the blood, starting with the most abundant cells. These are the red blood cells, their count or their number, their diameter, and their main function. Also, we have the neutrophils, eosinophils, basophils, and we have the agranulocytes in the form of lymphocytes and monocytes, and finally the thrombocytes of platelets, their count, their main features, and also their main functions. With this slide, I conclude this session. Thank you very much for attending this session, and I wish you all the best.